ICD 10 coding questions and answers with explanations. 30 most asked questions. Question 1. Which character in an ICD 10 CM code typically represents the laterality? First, third, sixth, seventh. The sixth character often specifies right, left, or bilateral. Question 2. And excludes one note in ICD 10 CM means not coded here. The two conditions cannot occur together. Not included here, but can be coded if both are present. Use an additional code. Code first the underlying condition. Excludes one is a pure exclusion. You cannot code both together. Question 3. Which of the following is a code for a STEMI of the anterior wall? I-21.09, I-25.10, I-10, J45.909. I-21.09 is for STEMI involving the anterior wall. Question 4. ICD 10 CM codes can have up to how many characters? 5, 6, 7, 10. Codes range from 3 to 7 characters. Question 5. The seventh character in an injury code usually denotes initial encounter, subsequent encounter, sequela, acute phase. Character is used for the period the patient is receiving active treatment for the injury. Question 6. Which code category represents essential hypertension? I-10, I-11, I-20, I-50. I-10 is the specific code for primary hypertension. Question 7. Sequencing. If a patient has sepsis due to a localized infection, which is coded first? The sepsis code, the localized infection code, either, it doesn't matter, the antibiotic used. If sepsis is present on admission, the systemic infection, sepsis, code is sequenced first. Question 8. What does NEC stand for in ICD 10 CM? Not elsewhere classified, not exactly coded, non-essential code, next encounter code. NEC means other. The documentation is specific but there isn't a specific code for it. Question 9. What does NOS stand for? Not otherwise specified, number of sessions, name of surgeon, new onset symptom. NOS is equivalent to unspecified. Question 10. A Z code in ICD 10 CM is used for zoonotic diseases, factors influencing health status and contact with health services, zero-cost procedures, end-of-life care only. Z codes are used for occasions other than illness, example history, screenings, checkups. Question 11. Which letter is used as a placeholder to allow for future expansion of codes? P, X, Z, H. The letter X is the official placeholder. Question 12. Codes from category I-50, heart failure, require an additional code for type of heart failure, systolic/diastolic, age of patient, insurance type. Specific codes in I-50 specify if it's acute, chronic, systolic, or diastolic. Question 13. When coding diabetes with complications, how many codes are usually required? 1 combination code, 2 codes, 3 codes, 0. ICD 10 uses combination codes that include the type of diabetes and the manifestation. Question 14. What is the code for a routine pregnancy checkup, first pregnancy? Z34.00, O80, Z00.00, N91.2. Z34 codes cover supervision of normal pregnancy. Question 15. A sequela is coded when the patient is still in the acute phase. The acute phase of an illness or injury has ended but a residual condition remains. The patient has a family history. The patient is being screened. Sequela, seventh character S refers to late effects. Question 16. Which chapter in ICD-10-CM contains codes for neoplasms? Chapter 1, Chapter 2, Chapter 9, Chapter 21. Chapter 2, C00D49, covers neoplasms. Question 17. The code for COVID-19 is U07.1, B97.29, J12.89, Z20.828. U07.1 is the specific code for confirmed COVID-19. Question 18. Laterality, which character is used for unspecified side? 1, 2, 3, 0 or 9. Typically 0 or 9 is used for unspecified side, but clinicians should be specific, 1 for right, 2 for left. Question 19. Which organization maintains the ICD-10-CM system in the U.S.? WHO, NCHS, CDC, and CMS, AMA. The Joint Commission. NCHS and CMS manage the clinical modification, CM, for the U.S. Question 20. True or false, you should code signs and symptoms if a definitive diagnosis has been made. True. False. Once a definitive diagnosis is made, symptoms that are integral to that diagnosis should not be coded separately.